share in
Yeah,
brief, what was the failure like here?
that's fine. So quick. It was again an implant overdenture. So the area I'm in is rural Pennsylvania. A lot of, I would say, edentulous patients, and then now they're getting the awareness that they can get better quality of life with overdentures, right? So my fees is very low for overdentures because I just want them to have like better chewing abilities and all that. So I placed the two implants. It went really well. But the next day, the patient walked into my receptionist and said that the number 22 is feels like it's coming out. Um, and I remember when
And
I
what
was
does that
placing
mean?
it,
What does that mean, coming out? Coming out like failing or poking out? What does it mean, coming out?
he literally said it feels like it's growing, like it's just like literally getting loose from the bone, like it's like because he felt like it's coming. I mean, I don't know what he meant by coming out. Um, so my receptionist called me if I want to see him again. So I said that I do want to see him again and maybe replace it. I mean, I haven't seen him since.
Okay.
But what what I remember from the surgery is that when I was doing this tooth, there was hardly any bleeding from the bone site, like in the sense like I could actually see the whole, like when I was doing the drilling and everything, I could see the yellowish bone. There was hardly any bleeding. Maybe that led to the failure.
Time out, doctor.
Okay.
What year did the patient graduate from dental school? He did, right? So we don't know. We don't know yet.
Okay.
This could be like a perfect case. I think I see some problems here, which I wanted to give you some constructive feedback on, but we
Okay.
don't know yet. You have to see the patient and see what is mean coming from the bone. Sometimes patients perceive, oh, it's like a little bit swollen, or they see the cover screw, it's coming out of the bone, and maybe it's a total failure and disaster, and we'll have to deal with it, when you see him. But let's wait until you have all the facts. Okay. Now, what I can see here, and this is not to worry, it's pretty common. Were these immediate implants?
Yes, they were.
That's what it looked like. So most of the time, the hopeless teeth in the anterior mandible, they're lost for a reason. Either it's a big infection or not, or they were so damaged that they started to over erupt. For most patients, what needs to be done, those implants that are placed, especially immediately, need to be placed deeper. They got to go in deeper for two reasons. They have to go beyond the alveolus, which is the type of bone that house those hopeless teeth. And your implants are a little bit on the superficial side. So that's, to me, a way to correct for next time. And second, if your implants are too superficial, the existing denture is dancing on top of them. That's issue number two, which can lead to failure or them coming out, like our patient doctor said. And second and third, if your implants are too superficial, you're missing out on interocclusal space, which sometimes we fight for. I mean, even a millimeter can make a difference. So take a look at, and by the way, your placement looks fine, but that to me here, again, I don't know if it's an intraoperative and you drove the implant deeper. This guy needs to go in deeper, at least 2-3 millimeters deeper. Like, wow, that deep? Yes, that deep, because it requires it in the anterior mandible. This bone will go away. And same with this guy. It needs to be deeper. The cover screw here, give you an idea. The cover screw needs to be subosseous. And how great is that? Because it'll protect the implant from the denture forces. That's my feedback to you, but I want to know what happened to the implant. Maybe it's terrible, maybe it's not terrible.
Just a quick question. If, let's say, this is an intraoperative PA, and can I take the implant out? When I take it out, where do I keep the implant so that it's of a quality that I can put it back in again?
Yeah, you put it back in the vial. You put it back in the vial. That's all. Put it back. It's not. I do this all the time. I put an implant in, it gets stuck halfway. I under-prepped the bone for some reason, or the bone was too hard. Reverse it, put it back in the vial, no problem. Go back, re-drill, do a hard bone protocol, tap the bone, go with a denser burr, go a little bit deeper, then go back, take the implant out of the vial, and put it back into in place, replace it again.
Okay, makes sense.
Totally legit. Now, implant fell on the floor. Okay, open a new one. No,
There's a
3-second rule.
no
3-second rule
3-second
does not
rule.
apply. Okay, but I love your energy. I love the fact that you're, I got it. I'm doing these cases. I want to get to the next level. It's fine tuning, and you're gonna face challenges. I get like so many complications every week. It's just part of what we do.
I
Okay, so
personally
great.
find placing implants in the lower anterior mandible difficult, and I get scared if I'm going out the buccal or out the lingual.
4
So
minutes.
I tend to be worried about it, and under prepping and not driving implants deep down enough is sometimes a theme that I see in a lot of doctors. So Dr. Chandan, how do you use guides, or you're freehanding all these?
I'm freehanding right now, but I just got the CBCT 2 months back. So I'm going to start with the guides, but haven't done it yet.
Yeah, I on my next case, I want to make sure to use a guide, because it was very stressful on me the last time I did 4 implants on the lower, and the patient was feeling it, so I was worried I was close to some structure. And you sort of lose orientation also when they're open, the shape of the mandible. So thanks for sharing all that.
Mm-hmm.
Get the
Thank you.
patient
You're
in for an
welcome. Thank you.
assessment. That was my comment. Superficial placement, denture pressure can cause early exposure. Thank you, doctor, and good luck with the case.
Thank you for your help.